Hello, Instagram friends and followers. This is the Care for AIDS first live Instagram. I'm going to wait for Justin for just a minute for him to join me from Atlanta. But today we're going to be live both from Nairobi here and in Atlanta, and we'll be fielding any and all questions you have about how we are responding to coronavirus, both in the field and in our Atlanta office. So glad to see so many of y'all joining. I'm just going to wait for Justin for 1 minute, and then we will go ahead and get started in updating you guys on what's going on. Great to see all. I see Sandy from Johnson Ferry and Abby and Jan. Awesome. Okay. All right. Here from the Atlanta office as well. Hey, Justin.
Hey, Molly.
How are things in Atlanta?
It is torrentially raining right now.
Oh, no. You stole the rainy season from Nairobi.
I'm in the inner room of the office in hopes that we don't get too much noise coming in on the call.
Awesome. Well, for those of you who have just joined who don't know us, I'm Molly Heacock, and I am live this evening from Nairobi. I'm our COO, and I've been here for a few months helping support our field staff. And Justin, I'll let you introduce yourself and then get started with the updates.
Yes. Well, my name is Justin Miller, and thank you for joining this first ever Instagram live call to get a COVID-19 update. Whether you're just taking a break for lunch or you're hiding from your kids in the bathroom, whatever it is, we're really glad. I'm back. We're really glad you're here, and we want to say that, seriously, we have been thinking and praying about you and your families, however you are affected by this crisis. It's often said in association with the HIV pandemic that if you're not infected, you're affected. And I feel like that's appropriate for the time that we live in right now. So I'm going to give a short update of what's happening on the U.S. side, and then I'm going to let Molly talk about how they're dealing with this in East Africa. At any point in time, please drop any questions in the comments that you have, and we'll be happy to answer those a little bit later on. But our response here in the U.S. has probably been similar to that of your own organizations. Our first priority is to take care of our staff and to make sure that they weren't exposed to this virus. And so we quickly moved to a remote working format, which we do 2 days a week anyway, which wasn't too hard to adapt, but obviously we still want to feel connected to each other. So we have been finding ways to facilitate that connection via Zoom. We had a Zoom virtual lunch together last week and are going to do a Zoom coffee break this week as well. So our staff is all doing well. Their families are well, they're healthy, and we are pressing forward. Obviously, our next response was to just try to check in and care for our donors however we can. There's obviously a lot of uncertainty in their worlds as well. They have loved ones who are suffering with the virus, and so we've just been trying to touch base with them. And we've seen obviously an outpouring of generosity from them as well, as they have continued to give faithfully despite the uncertainty that they're facing in their own economic situations. So we thank you for all of you who've reached out to encourage us and pray for us. And then obviously, as we look towards the more midterm of what the next 6 to 12 months is going to hold at Care for AIDS, the most important thing is that we obviously are best stewards of the people and the financial resources that we've been trusted with. And so for that, in the U.S. and in East Africa, we want to ensure that our 68 programs remain intact, and that all of our staff, which now is over 200 individuals, are able to remain on the payroll as we weather this storm. So we don't know, thankfully Care for AIDS was in a very strong financial position, but we went ahead and we cut 10% of our operating expenses for the year just so that we could have that additional cushion if we entered into a recession or we enter into a time where our donors are not able to continue supporting Care for AIDS because of their own hard times. So, and then we're thinking about what does this look like going forward, and are there other strategic partnerships that can be formed in the midst of this crisis? So we're talking to foundations and corporations and government entities who have a particular focus on caring for those that are most at risk for COVID-19, which our clients are among those. So even in the midst of a really dark time, there may be some new partnerships that emerge that could actually help to advance the work of Care for AIDS in this year and beyond that. So thanks for tuning in. We'd love to take some questions, but I'm going to first let Molly give an update of what's happening on the African side.
Thanks, Justin. Just like on the U.S. team, our highest priority here is the health and safety of our staff and clients. As Justin mentioned, we have about 200 national staff here, and they are actively caring for about 4,000 HIV positive clients right now. So as soon as coronavirus hit Kenya, Tanzania, and Uganda earlier in March, we went ahead and under the great leadership of Cornell and Duncan and our core team here, pivoted really quickly to do telecounseling for all of our clients. So as many of y'all know, most of our clients, all of them are HIV positive, and if they have not reached viral suppression, they have a suppressed immune system. So the clients are more vulnerable to any type of infection. So we wanted early on to make sure that their health and safety was really taken care of. So instead of continuing to meet in the centers for one-on-one counseling, for group therapy, for economic empowerment, we went ahead and in Kenya and Tanzania early in March and in Uganda early last week, went ahead and had all the clients just stay home, self-quarantine, self-isolate, and all of our counselors have done an incredible job of pivoting to do their normal counseling routine, but over the phone. So it hasn't been without its challenges, as our counselors would tell you. We continue to struggle with some confidentiality issues now that the clients are confined to their homes. Some of them are not able to speak as openly about their status as they would in the privacy of our offices in the churches where we work. But the staff is incredible, and they're creating code language so that they can better work through issues with clients who don't have a lot of personal space and who are in the room with their families and their spouses. And as of this week, we were actually able to reach 80% of all of our clients to get their regular one-on-one counseling across all 3 countries where we're working, which is incredible. I just really cannot say enough about how the staff here have adapted and how they are just up for anything to take care of the clients that are under their stewardship. So programmatically, we made those changes about 2 weeks ago. When it comes to the actual caseload of coronavirus here, we're a few months behind the rest of the world in the first cases. So far, as of today in Kenya, there are 50 cases and there's only been 1 death so far. In Tanzania, as of today, there are 19 cases with 1 death, and in Uganda, there are 33 cases with no deaths so far. So each of those 3 governments have done their part in really encouraging social distancing, encouraging working from home. Kenya and Uganda in particular have instituted 7 p.m. to 5 a.m. curfews. So all of the non-essential businesses here have been closed. No church gatherings, no funerals, no weddings. All of those large group gatherings have been postponed, very similar to the reaction in the U.S. All the schools in all 3 countries have been closed. So I know that our staff, both admin and counseling staff, could use your prayers as they work on counseling clients from home and also homeschooling their kids and doing all of their normal duties, just like y'all in the U.S. So that's one huge prayer request for our staff here, is just finding some sort of balance and peace in the midst of all of these pivots and transitions. But we're really happy to let y'all know that so far programs have continued. Some of our staff are even experimenting with what it might look like to do group therapy, either on a conference call or in a group text over WhatsApp. So we are able to get creative in how we're using technology and social media in particular to kind of try and continue the relationships that we started. For those staff that were on leave who had classes that graduated in February, we're just extending that leave. But as Justin said, our highest priority as a leadership team here in Kenya and in the States has been just to maintain continuity with all of our staff. We want to make sure that we're able to pay their salaries just as we usually would, and have them do as much of their normal work as they can to really care for the most vulnerable people here. Many of y'all have been able to hear from Duncan in a video that he did last week when we first started pivoting the programs. You'll get to hear from Cornell a little bit later this week, and some of the other key African leadership here. We'll be doing video updates for you guys just to keep you encouraged, to keep you in the know. For those of you who are supposed to be in Kenya, friends from Johnson Ferry, friends from LifeShape, we miss you dearly, and the staff are praying for you, and very sad that we're not able to connect in person, but we're going to make sure that we can connect with y'all virtually as much as we can in these coming weeks and months. When it comes to the timeline here for how long we'll be working virtually with our clients, we really don't have a ton of insight into that. We are preparing to do another food distribution for our clients to last them through April, because we don't foresee returning to normal operations before probably the end of April here. But we are prepared for that. We're improving telecounseling. We're making sure the clients have the food that they need to make it through these difficult times. And yeah, I just want to reiterate, Justin, and thanking you all for the many notes of encouragement and for the continued support and prayer. The team here, as always, are living saints and have just pivoted really beautifully in these extremely difficult times. But so far, so good. So we want to open it up to any questions that you all have. Just at the bottom of your screen, if you want to type into the comment box if you have any questions. Justin, I'll let you add anything while we wait for some folks to submit their FAQs.
Yeah, well, somebody commented they enjoyed the book. Thank you for that. Maybe this quarantine time will give people an opportunity to do some reading. So thank you for checking out Beyond Blood. There are some questions that we got submitted ahead of time. I'll just field a couple of those, and then if you have more, please submit them. One of the questions is, are you still sending trips to East Africa? And I think we are all counting down the days when that can happen again. Obviously, in Kenya right now, they have suspended all international flights in or out of the country, which means that Mali is there indefinitely until something changes. But right now, obviously, it would not be in the best interest of our teams, nor our staff or clients to be thinking about trips. We are looking out. We're looking at the summer, June and July, August, and we're week to week evaluating, is it possible for those trips to go? I think it's likely, with how far Kenya is behind the rest of the world with COVID-19, that there could be, this could extend on into the summer months, and we would end up having to postpone all of our trips that happen this summer into either the fall or pushing them into 2021, which, you know, we're disappointed about, but that is just what the times require us to do. So that was one question we have. And specifically, someone asked when I anticipate going back. I was blessed to be able to go twice in the first quarter, which was unusual for me. So I've thankfully got a chance to spend some time with our staff here recently, but I was supposed to be back in June and then again in August. So I hope that by August I can be back in country, but don't know the firm answer on that yet.
I saw Tammy submitted a really good question that I meant to address. I'm glad. Thank you, Tammy, for reminding me. She asked, how have the changes impacted medical care and access for clients? And then someone else I just saw asked about access to ARV medication for the clients. So luckily, for the dispensaries, they are moving forward as usual, essential services. As long as clients are accessing the dispensaries before the curfew, they shouldn't have any problem, as they're kind of separate from the medical facilities that we would be worried about being overburdened by COVID cases. So that is a blessing. When it comes to general medical services for clients, another exciting pivot we have been able to get creative with at Care for AIDS is how we are able to offer telemedicine in addition to telecounseling to the clients. This is something that our program manager, Lydia Career, was working on a lot today even. I just got an email from her with some updates on how we're going to go about this in the coming weeks. I'll get a video from her to share with y'all, hopefully in the coming weeks, to get more information. But essentially we'll be using the nursing staff that we have in our rural programs and on our admin team, people like Lydia, people like our new health technical advisor, Janet, who joined the team the day we went remote. So she's been a trooper already. And our nurses and PAs who are working out in rural. Essentially, we will divide them all up between regions, and each region will have an on-staff medical professional who will be able to field calls from clients who have just general questions that don't necessitate emergency services, but they'll have access to a nurse through Care for AIDS who can, based on what they need, perhaps write a prescription if that's appropriate, or connect them to the necessary care. So we have been able to get really creative, and instead of doing the home-based care that we generally do with our more clinical medical staff, we're going to transition that to telemedicine, and we'll let you know how that goes over the coming weeks. But yes, necessity, as they say, is the mother of invention, and our team here has been very creative and very willing to pivot in those ways. Thanks for that question, Tammy.
I will just add to one of the things that you can add to your prayer list for our clients especially is that we are in Kenya right now. We're entering into the heavy rain season, which I've had some people ask me, well, do you think that in the hotter seasons to come that will help to slow the spread of the virus? And while I know there's still a lot of debate about the merits of that and whether or not that decreases the life of the virus as it lives on surfaces and stuff, in Kenya, they're actually entering into their colder season, their rainy season. Our clients already experience a lot more just sickness during this time because of their compromised immune system. So that is something that is going to be a challenge for our clients as the weather turns colder. The Kenyan immune system and bodies in general just can't handle the cold weather that well either. And so it is a challenge. We even, unfortunately, had one of our churches that was actually, that was in a mudslide just a couple days ago, and the whole church was destroyed. Thankfully, no one was inside, but these communities are not built to handle a ton of rain. And so it actually challenges a lot of the infrastructure in those places, and then the physical wellness of our clients suffers during this time as well. So that is a really important prayer request going forward.
Definitely. I think Shelly, hello Shelly, asked about the staff morale, which is such a great question. All in all, if any of you have ever been to East Africa, met any of our staff, you know that they are just the most committed people in the world to the clients that they're serving. But I have to be honest and say it's been a really difficult transition, not just to telemedicine, but just the atmosphere in Kenya and Tanzania and Uganda has been a little scary. We don't know how the virus will progress here. As many of you know, the health systems, similar to in Europe and in the US, just aren't built for a widespread pandemic. So there is some fear, there's some anxiety, there's stress. They're not immune to that, just like anyone. I know we're all feeling that in the States. Every time I talk to friends and family, there's this like low-grade anxiety that just seems to hang in the air, and it's no different here. So while the staff are up for anything and they're just performing incredibly, and it hasn't been without its challenges. So that's another prayer item for our team here, is that they would be able to find some peace and some balance amidst a quarantine. Kenya in particular has had some friction with the implementation of the 7 p.m. curfew. Many of you may have seen some brutality issues in Mombasa. Luckily, thank God, none of our staff or clients were involved in that, but it's a time of high stress and anxiety here as the government tries to enforce new codes, and as people learn about the virus. There's also a lot of misinformation going around social media, just like there is in the States. So if you infuse that into your life too much, it can just cause a lot of stress and anxiety. So we're working to keep morale really, really positive, but it is a hard time, and we would definitely appreciate prayers for the staff as they take on the extra workload of learning how to telecounsel, learning telemedicine, homeschooling their kids, learning how to survive in a quarantine. So thank you for that question, Shelley. It's definitely a prayer item that we would love help praying for. Ooh, Justin, here's a good question for you. Is there a way for people to help?
Yes, definitely. We would, obviously, as Molly's already shared, we would just covet your prayers over our staff and clients in East Africa, especially, as well as our staff here in the U.S., who are juggling the same tension of caring for their families and being present at work. I would also say, we are, as Molly has shared, we're looking at creative ways that we can bring more training and also encouragement to our staff during this time. So one of the things we're doing is we're creating a series of training videos from people who are familiar or who are counselors who have specifically done telecounseling in the past. So there may be some expertise that you have that could help our clients, our staff during this time, understand how to cope with the challenges that they're facing, dealing with the trauma that they're experiencing, both personally and secondhand to our clients. And so, and maybe some best practices of how to counsel remotely by phone. So that's one thing you can do. We are going to hopefully explore some ways where you guys can send messages of encouragement that we can then relay to our staff on the ground as well, just to give them just that injection of energy and hope in this time. And then obviously there are a lot of needs that are around us. Care for AIDS is one of many organizations that is trying to continue to operate in the midst of what is just the beginning of probably a really challenging financial season to come. And so as people are able, beyond the personal needs that I know families are feeling, if there's an opportunity to continue to support Care for AIDS financially, know that we are continuing to operate, and those funds are going to be relayed to the field where we can help serve this population that's extremely vulnerable to COVID-19.
I will add to that, Justin, as another way that we're pivoting here, that the team is responding more specifically to COVID prevention among our staff, or among our clients and staff, is, of course, as some of y'all may have read in our first letter, we're doing a lot of education just about, hey, here's very simple ways that you can prevent, here's what social distancing means, all of that good stuff. But we also have a certain amount of funds for each center that's built into the budget that every year goes to help clients pay for necessary medical treatment. So whether that's hospital visits, opportunistic infection treatment, anything like that, we are still funding those things for clients, particularly if any of them, we haven't had any clients have symptoms or test positive for coronavirus, but if that were to be the case, we would want to make sure that there were no financial barriers to them getting care. So that fund for each of our centers is there for that. But we're also, in addition to that, telecounseling and helping them get transportation and treatment when needed, using some of that money to purchase and distribute some bulk hygiene products. So whether that's hand soap, sanitizer that's 60% alcohol, any of those needs that our clients don't necessarily have easy access to in their context, we want to make sure that each of our centers, our church partners, and our clients are really well equipped with the necessary preventative measures. So we definitely, we're responding, we're pivoting even more to be Corona specific while still trying to maintain our current or our past medical services for all the clients. Sandy, thank you. We will tell our Babadogo staff that y'all are praying for them. Thank you for joining.
Well, we'll give a couple more seconds for any final questions. We're going to wrap up here in just a second. I know that somebody had submitted the question of how are you guys coping with this personally? And, Molly is obviously trapped in her house in Nairobi, and she can talk about that. But this is a time that I don't think any of us wished for. But I think for me, it's been really a special time. I'm sheltering in place in our office today because I have 3 kids under 5 at home. So this is the only place I could find a quiet space to do this call. But I do think that my wife, Lindsay, is obviously, she's a champ, and she's been navigating this so well. But we're trying to just juggle the demands like most of you, just being there to care for the children, create things to educate them, entertain them, to wear them out. And it's a challenge to live both in that space of caring for the family, but also still doing the work that needs to be done. And so, but I think it will also look back on a very special time where travel was canceled, conferences have been canceled, and I'll probably have 3 or 4 uninterrupted months with my family, which is something that I would not get afforded very often. So I think we're doing well in our house, but definitely keep praying for us as we try to manage the crazy.
That's awesome. Yeah, I will say it's been relatively easy here. We've got such a great community. If any of y'all know Cornell and Duncan, you know that they have taken really good care of us as the foreigners here. And y'all will be hearing more from them in the days and weeks to come. To give you a quick update, Cornell is in Kisumu supporting our staff there with his whole family, and then Duncan is just down the street supporting the Nairobi staff. So they both have been just running overtime to make sure that the team here has what they need, and that includes us. So we've felt very, very well taken care of, as y'all can imagine. But yes, my kind husband and I have been holed up in the beautiful Kiambu house for a little bit, but it's been really good, and we've been really blessed to be here during this time. It's been very encouraging. The staff here has been really amazing at encouraging each other digitally. We'll be sharing some encouragement videos from both key African leadership, but also staff from across the organization, just sharing scripture, sharing prayers, sharing encouragement, both meant for folks here and for people abroad. As a team here, we've never felt more connected emotionally and just spiritually to our family halfway around the world. So we want to thank y'all so much. The prayers are so felt here, and it's very encouraging to that morale question for our team of 200 to know that there's countless people in America praying for them, supporting them, but who are also experiencing a lot of the same things. So it's a very cool thing to know that we're all homeschooling the kids. We're all dealing with anxiety in our own ways, and we're all just trying to make it through this together, which is a really, really beautiful picture of the kingdom of God, which we really appreciate. So if we don't have any final questions, it's been so good to see everyone pop up on here and have some comments. We thank you guys so much. Again, we can't say it enough for y'all's continued support, for your concern. We'll continue to keep you updated as things change and morph and pivot over here. This is the last thing that I'll update everyone on, but one of the more exciting innovations that we've been able to fast track during this time is we had already been working on a mobile app for our clients so that they could get information about other services in their community, so they could access Care for AIDS content after they experience it in person, so they can keep up with their medication, set reminders for when to take their medicine, keep journals, voice memos, things like that. So it's something that we had in the works earlier this year, and we'll do a more formal announcement later. But our trusted community here, we wanted to let y'all know that we're fast tracking that app during these times because it'll be a really cool way for us to keep in touch with our clients and to push out content and announcements to them, especially during this time of social isolation, where they may feel kind of a double dose of trauma. As many of you know, our clients already are relatively isolated before they come to us in the program. And so we want to make sure that we're addressing that both on the phone, anytime we can do chats and video calls, but to remain really connected with them and really leverage technology that we can leverage in this time is going to be amazing. So y'all stay in touch with us to get more updates about that app when we finish it, when we're able to roll it out, and how that's going to help us get through this time while still maintaining really close contact with our clients and caring for them really well. So yeah, Justin, any final words before we wrap up for the evening, for the afternoon for y'all?
No, just thank you again. We're so blessed by the community around us, and we will continue to keep you updated. But I would ask for you to just share with us as well. How can we be praying for you? How can we support you in your nonprofit, your business, as you have needs that we can address? We'd love to be a part of that in some way. So we'll be back on hopefully in the next couple weeks and do more of these sessions so we can share more updates.
Awesome. Thank you all so much. We love y'all, and we will talk with you again soon.